Hello and welcome to Microscopic Diaries. I'm Sadegova, your host. Today we have an interesting topic to discuss, but before it, have you ever used antibiotics? If not, congratulations, and hopefully you won't need them anytime soon. If yes, welcome to the club. Most of us have. And is there a smell from the person sitting nearby? No blaming. Maybe this person just using antibiotics? Yes, today we will explore how your skin and gut microbes shape your natural scent and what happens when antibiotics disrupt this balance. Body odor doesn't come from sweat alone. In fact, apocrine sweat is almost odorless. The smell comes when microbes, especially Corynebacteria and certain Staphylococci, break down proteins and lipids into pungent molecules. Some bacteria make onion-like compounds, others goat-like fatty acids. Even your gut microbes contribute by producing smelly gases like hydrogen sulfide or trimethylamine, which can seep into sweat or breath. Antibiotics disrupt these microbial communities in several ways. Broad-spectrum drugs greatly reduce microbial diversity, often killing both pathogens and commensals. This can remove odor-producing bacteria, for instance, eliminating odor-generators may lessen foul smell, but it can also let other organisms dominate or alter metabolism. Antibiotics can eliminate other microbes. They can wipe out specific odor-producers. For example, treating the skin or gut with broad antibiotics will kill many normal flora. If key odor-forming species like Corynebacterium or odor-producing Staphylococci are reduced, the characteristic skin compounds they produce will decline. Conversely, reducing competition can allow hardy microbes or fungi to overgrow. This dysbiosis may produce new smells. By depleting gut flora, antibiotics reduce production of gut-derived odors. In trimethylamine, for example, antibiotics are used to poison trimethylamine-producing gut bacteria, greatly lessening the fish's sweat or breath. Similarly, rifaximin and other antibiotics are prescribed in liver diseases to cut ammonia-producing gut bags, reducing the ammonia smell or breath or sweat. Killing of protective bacteria can unmask other problems. For example, vaginal antibiotics often disturb lactobacilli and can lead to bacterial vaginosis, a condition where anaerobes produce a fishy odor, which is then treated by further antibiotics. Likewise, antibiotics for oral or sinus infections can change breath odor by altering the local microbiome. How do antibiotics affect on the skin microbiome? Topical or systemic antibiotics can alter skin flora or thus smell. In fact, many commercial deodorants and perspirants already use antimicrobials that reduce underarm bacteria. Experimental evidence shows dramatic effects. In one microbiome transplant approach, subjects first wiped out their armpit bacteria, then repopulated the skin with microbes from a non-sticky donor. The result was a markedly milder underarm odor for at least a month. This demonstrates that removing odor-causing microbes can quickly change body scent. However, not all antibiotic use has a large effect. One clinical study found that treating a skin infection with systematic antibiotics caused no significant change in microbiome of other skin sites. In practice, if antibiotics kill the right microbe, the aroma of sweat can shift. But written short courses often produce only subtle or temporary odor changes. One of the main interesting questions here is how long this change lasts. Is it the temporary or long-term change? Most antibiotic-induced odor changes are transient. After a course of antibiotics, gut and skin microbiomes typically rebound toward their original state over time. Studies show broad-spectrum antibiotics sharply drop microbial diversity, but a healthy microbiome is resilient. It often recovers substantially within weeks or months. In contrast, a single written course often has minimal lasting effect on skin odor, as one study of skin infections found no significant microbiome change at involved skin after treatment. In summary, antibiotics can change a person's natural scent by altering the microbes that generate body odor. They may also create new imbalances that lead to different odors. These effects are usually strongest while the antibiotics are active. Over time, skin and gut communities tend to re-establish the original balance. Today we explore something we don't often think about, how antibiotics can change the way we smell, from wiping out odor-causing skin microbes to altering gut bacteria that release compounds into our sweat and breath. Our sun really does tell a microbial story. Remember, most of these changes are temporary. Once your microbiome recovers, your natural scent usually returns, but it's also a reminder of just how connected our microbes are to who we are, even down to the way we smell. Thank you for listening, and as always, stay curious, stay healthy, and never underestimate the invisible world within you. See you in the next episode.